And as far as covering sepsis in 12 minutes is like almost impossible. So I have tried to keep the very basics in this presentation so as to cover the ABC of sepsis. Requesting the chairpersons to please allow me to take this presentation from down.
Yeah, sure.
Thank you. So, I think you must be aware about this incident which happened during the surgical strike, Balakot air strike in 2019. Here is an Indian helicopter which got crashed by our own missile. And you also remember this gentleman who is Wing Commander Abhinandan Vardhan, who happened to land his aircraft in Pakistan, and then the whole story you know. So the purpose of showing this photograph is like explaining you what is sepsis. It is like when your own missile hits your own body. So definition of sepsis, the recent definition of sepsis, syndrome of life-threatening acute organ dysfunction due to dysregulated host response to the infection. So the important word has been marked red. Important thing is, it is not the infection. It is the dysregulated host response. It is the person's immunogenic system responsible for creating sepsis. So life-threatening acute organ dysfunction, when it is associated with organ dysfunction due to dysregulated host response to infection, this categorizes the recent definition of sepsis. So disclaimer, I have tried to keep my presentation very basic for the sake of the beloved audience. So as far as the guidelines goes, guidelines का काम है आना और जाना. जब तक ये हम 2001 की गाइडलाइन को समझ पाते हैं, तब तक 2025 की गाइडलाइन आने वाली होती है. So these are the guidelines, ever changing guidelines. We are in a pool of epidemic of information. So these guidelines proceed from 2001, 2004, 2008 to the recent most of 2018 and 2021, which recommended a bundle of 1 hour and 3 hour. I will not go in detail of the whole guideline because it requires days together to discuss it. So continuum of sepsis, SIRS, sepsis, severe sepsis, septic shock. These terms were coined in 2001, which we are still not familiar with, but some of them has been taken off. So the definition of sepsis according to the SIS criteria in 2004 was having two criteria of the temperature, heart rate, tachypnea and white blood cell count, which proceeded to sepsis, severe sepsis, septic shock and multi-organ dysfunction according to the old definition, and now this has been changed. So हम लोग जब तक ये definition को समझ पाते हैं तब तक वो change हो जाती है. Global epidemiology, as far as I believe, almost around 48 million cases, 11 million related deaths annually happening in the world. First definition in 1992 described overburdened inflammatory response to infection. SIS is no longer included in definition of sepsis, but it helped to identify the infection. So approximately 85% of the cases and disproportionate death, they happen in low and middle income countries. The crux of the matter is that majority of the data of sepsis is from the developed country, but जो सबसे ज़्यादा sufferer हैं वो low and middle income countries हैं. And as far as the side goes, 40 to 60% are pulmonary, 15 to 30% are abdominal, 15 to 30% are genitourinary. This is the data from the West. Pathogen identified only in 70% cases. Most common cause is gram-positive or gram-negative bacterial infection, followed by fungal and viral. And we recently saw a viral pandemic during the COVID times, leading to a huge number of septic shock and sepsis resulting out of it. So this is in Indian context. What is the prevalence? According to the definition of sepsis 2 and the sepsis 3 recently released in 2018, a huge number of patients, they die from sepsis as in India. And you know that Madhya Pradesh तो इसमें रिकॉर्ड कायम करता है. हम लोग यदि देश के सबसे ज्यादा बीमारी राज्यों की एक लिस्ट बनाए तो हम लोग नीचे से आते हैं. So as far as maternal mortality goes, this is the data published. Maternal mortality ratio Indian state, और हम लोग असम के बाद नेक्स्ट नंबर पर आते हैं with 173 एवरेज. when it comes to infant mortality rate, आप देख रहे हो कि मध्य प्रदेश टॉप्स द कंट्री, और हम लोग कहीं दूर नहीं है, इसमें से डाटा कलेक्शन कैसा है हम सब जानते हैं, और यहां देख रहे हैं कि भोपाल डिस्ट्रिक्ट सबसे ऊपर है। इसका मतलब ये नहीं भोपाल में सबसे ज्यादा डेथ हो रही, मे बी कि वहां से डाटा आ रहा है। तो पॉइंट इज कि सेप्सिस इज देयर, राइट। सर्वाइविंग सेप्सिस कैंपेन, दिस इज अ रीसेंट गाइडलाइन व्हिच रिलीज 93 रिकमेंडेशंस। यदि मैं बात करने लगूं तो 2 दिन का समय निकल जाएगा, सो आई विल नॉट go in very detail. So the continuum of sepsis, now the sepsis diagnosis depends on the SOFA score. SOFA is a critical care setup score which has to be implemented in the ICU, and the other one is when the sepsis is associated with a lactate level of more than 2 millimole or a mean arterial pressure of less than 65 along with the vasopressor. That qualifies the definition of septic shock. So this is the SOFA score, sequential organ failure score, which have 6 categories and marking from 0 to 4. When the score is more than 2 or change in the score is more than 2, it qualified to be labeled as sepsis. So these include respiratory coagulation, liver related, cardiovascular, CNS and renal creatinine as parameters. Because of short of time I will not go in detail of that, but viral sepsis increased dramatically during pandemic as we saw recently. The risk factors include immunosuppression, prolonged neutropenia, environmental exposure, chronic lung disease. Incidence is highest among the extremes of age. तो जैसा अभी डलोरी सर बोल रहे थे, 65 years के ऊपर, 60 years के ऊपर incidence dramatically rises, and also in the children. And immaturity of the immune system experience some of the excessive risk. As far as the pathology goes, dysregulated immune response resulting in organ dysfunction, progression to sepsis influenced by viral pathogens, and evidence host features and maladaptive tolerance mechanism. Expected inflammatory response contribute to it and contribute to organ injury and perpetuate disrupted immune homeostasis. Dysregulated vasculature, important component in this. Vasculature is the key site of sepsis. Complement system is critical for the host defense, microvascular thrombosis, and when manifest as hypotension, third spacing of fluid, and frank disseminated intravascular coagulopathy. Clinical presentation might include various varied signs, which may be sometimes general signs of infection like fever, hypothermia, malaise. Related to the site of involvement may be cuff dysuria, erythema, symptoms of acute organ dysfunction. So whatever organ is involved, that can contribute, like if CNS is involved, it can contribute to confusion, if renal system, oliguria, and if lungs, dyspnea. So common signs and symptoms are not specific to sepsis and may be masked by medication, which often the patient receives earlier to presenting to your emergency department. So severe sepsis or acute organ dysfunction that is not clearly attributed to a non-infectious cause should be viewed as a potential sepsis. You should look for the clinical and laboratory evidence of acute organ dysfunction, altered mentation, hypotension and tachypnea, particularly they are suggestive of sepsis. So there are no specific signs, but some of the signs can guide you, and it should be in your diagnostic, it should be in your probable diagnosis criteria to see for severe sepsis or sepsis when you see change in mental ability, difficulty in breathing, bluish discoloration, chills, or any other sign like decreased urination, dyspnea, unconsciousness, abnormal heart function, etc. So here is a slide which you see 3 category of patient. So one is a car accident, young victim. Other one is a 70-year-old male having a chest pain. And third one is a 70-year-old male conscious person being examined by a doctor with a blood pressure of 88/50 and heart rate of 100. यदि हम लोगों को मौका दिया जाए कि इमरजेंसी में तीनों ये प्रेजेंट करें, तो आई बिलीव हम लोगों में से ज्यादातर लोग ट्रॉमा को या एक्यूट एमआई को पहले अटेंड करना चाहेंगे. बट फॉर योर नॉलेज मैं ये बताना चाहूंगा कि द फर्स्ट कैटेगरी of trauma carries a mortality of 30%. The next picture carries a mortality of 10%. And the third category of sepsis with hypotension carries a mortality of 30%. So the message is you should not underestimate the severity of sepsis. Mortality is very, very high. With a SOFA score of more than 10, mortality is significantly high, and it is very difficult to save the patient. So as far as the clinical evaluation goes, it can be with varied presentation, leukocytosis, leukopenia, more than 10% of granulocytes, hyperglycemia, elevated level of creatinine and lactate. Even in absence of fever, localizing signs of infection, you can have sepsis. It should be considered in all patients with altered mentation, hypotension, dyspnea and acute decompensation of chronic disease. Clinical evaluation focuses on the confirming the site and cause of infection as well as the evaluating organ dysfunction. Common testing to evaluate the function include radiological studies which you can use according to your clinical sense, microbial culture, antigen testing. There are various guidelines available about the bundles which we take care in the intensive care. Lactate measurement is recommended in all patients to look for the occult hypoperfusion. And there are signs of hemodynamic instability which we often see. So these signs can be, some of them can be static signs, some of them can be dynamic signs. So these hemodynamic stability signs can be divided into two categories. One can be related to blood pressure, one can be related to perfusion. So as far as the routine signs of blood pressure, seeing hypotension, tachycardia, orthostatic vital sign change, multiple fluid doses required to maintain adequate blood pressure, we commonly practice. But what we fail to practice and what we fail to understand is that despite of a proper BP, you can have inadequate perfusion which can be measured by lactic acidosis more than 2 millimole. Abnormal capillary refill, wonderful clinical sign which can be utilized in the resource deficit setting like us. Reduce urine output, new altered mental status, pool motor extremities which can be seen on inspection easily, which should lead you for the suspicion of sepsis. So these are the signs which can be taken care. So as far as the sepsis management goal, there are multiple things which can be discussed in the guidelines, but just keeping it short. So what we want to do, we want to keep the things perfused. We want to fill the tank. Fluid deficit को correct करना चाहते हैं, perfusion को maintain करना चाहते हैं. We want to get the pressures up. So, and सबसे बड़ी बात ये, पहले क्या करना? We want to do everything concurrently and quickly. That is all about the 1 hour bundle. What guidelines say. So the management include infection control, restoration of perfusion, organ support and vasopressors. Antimicrobial therapy is often empirical. Prompt initiation of antimicrobial therapy is warranted as the mortality increases. Duration of antimicrobial therapy is to be tailored according to site and type of infection. And removal of the source of infection may be done. Removal of infected intravascular device, relief of anatomical blockage proximal to the site of infection. Source control is time sensitive, mortality increases. Restoration of adequate perfusion, hypotension and inadequate perfusion will lead to mortality. Intravenous crystalloid is the first line of treatment. 30 ml per kilogram of body weight is a reasonable initial fluid level which can be offered to a person within the first 3 hours. Delivered in serial bolus with close monitoring under an over resuscitation. Giving extra fluid or limited fluid is always harmful. So harm from the higher resuscitation as seen in the studies have used significantly more fluid than 30 ml per kg. Vasopressor therapy is always required. Norepinephrine is to be considered as the preferred choice, preferably via central IV access. Guidelines recommend targeting an initial mean arterial blood pressure of around 65 mmHg. Worsening clinical condition should lead you to reinvestigate the case, finding out the source of infection. Imaging studies to define better site of infection. And area of controversies are still there because जो भी data आ रहा है western world से आ रहा है, जबकि 85% of the sepsis is happening in the resource countries. So we have confusion regarding a lot of things like diagnosis. We still lack a clear-cut definition, easy definition for sepsis. Subtypes of sepsis has to be defined precisely. Targeted treatment, although हम लोग बहुत सारी चीजें treat करते हैं, but ultimately the target therapy like perfusing the person has to be seen. Sepsis in low middle income countries might require a different approach for which a special guidelines need to be framed. And as far as take home message goes, it is a life-threatening acute organ dysfunction due to dysregulated host response. Host response is not the weakened immune response. It can precipitate it, but it is the host response. It is a major and growing healthcare problem in our region as seen and observed by the organizers, respected Daloria sir, Dr. Vivek Saxena sir, Chaturvedi sir, who has requested to talk on this topic. Although in very brief, early identification and appropriate management definitely improves the outcome. Education. तीन education के बाद तीन अलग अलग लोगों के लिए. Expert like you need to be educated. Peripheral healthcare workers need to be educated, and public at large need to be educated. And I thank the organizers, the Daloria sir, Verma sir, Chaturvedi sir, Vivek Saxena sir, for the kind permission they have given to me for presenting this short ABC of sepsis. Thank you very much.
Thank you, Dr. Nanda.